All right, Annette Romios.
Hi, Ben.
Hi. So Annette is an acupuncturist and she specializes in working with infertility issues, correct?
Correct.
And I know that you have a special certification for that. And can you say what that is again?
Yes, I'm a fellow of the American Board of Oriental Reproductive Medicine, which is a specialty board that was created to really certify acupuncture practitioners in the treatment of fertility using acupuncture and Chinese medicine.
Okay.
Yeah.
So you have a lot of experience and information on how to work with people specifically for that.
I do.
And I know acupuncture is good for so many different things, but I think it would be really useful if you could talk a little about how that specifically helps people with infertility and what it actually does for them, just in general.
Mm-hmm.
Yeah.
So everyone knows really that acupuncture really helps to relieve stress. That's one of a big thing that it can do for people. And as people who are struggling in fertility often undergo stressful situations, whether they're going through assisted reproductive technologies, which would be things like IVF or IUIs, those things can be stressful. So I think that one of the ways that acupuncture really helps couples who are trying to conceive is that it lowers their stress level. But even more so, what acupuncture does is it really can increase the blood flow to the uterus and ovaries, which helps many aspects of fertility. So it can help improve egg quality, and even I've seen egg quantity numbers increase during an IVF cycle after acupuncture treatments. The other way that acupuncture can help couples who are struggling is, if there has been some determination of some kind of problem or difficulty, such as endometriosis or polycystic ovarian syndrome, those things are all treated with acupuncture. So really acupuncture can help couples trying to conceive in a number of ways. It really depends on the given situation.
Right. So it can help specific medical, physical issues that are interfering with pregnancy, as well as increasing blood flow to the areas that need it for reproduction, and decreasing stress.
Yes,
so
yes.
all of those.
And in men as well. So if men are having issues with morphology or
what's morphology?
Morphology is how the sperm are shaped. So they can have two heads sometimes, or two tails, or they can be shaped oddly, and so there are different things that we can do to better the morphology of the sperm.
I see.
And then motility as well. So how well they're swimming, how well the sperm are swimming.
Yeah, like little fish.
Right.
They've got to get there.
They've got to find their way to that egg. That's right. So those.
I think that's something people don't usually think about, is the male part of that equation, and if there's issues there, then that can interfere with fertility as well.
Absolutely.
So you work with both people normally?
Yes. Yeah, it depends.
Depends. You get tested first, and then whatever the situation is, you then proceed.
Yeah, so part of what I do when a couple comes to me is really do an extensive history and background to assess the situation, so that I can come up with a treatment plan that is really right for them. So it's really individualized for the couple. So that may involve treatments for the male, and it may not. It just, again, depends on what the situation is specifically.
And what percentage of people would you say that come to you are also working with a doctor in some other way for fertility?
I would say it's probably about 50%. Yeah, so 50% of the couples are still trying to conceive naturally. Maybe they just haven't gotten to that point yet, and then the other 50%, it could be women maybe who are a little bit older, and they're really they're needing to do IVF because it's been told to them that it's their only option really. So
Right.
acupuncture done in conjunction with IVF can make the IVF more successful. It increases the success rate.
Makes the IVF more successful.
Yes. Yeah.
And I know that statistically, the older women get, the more the likelihood of conception goes down.
Mm-hmm.
So if they weren't doing IVF and they just came to you for acupuncture, how successful is that for an older woman trying to conceive?
You know, that's a really hard question to answer just because every case is so different.
Right. But you do get clients that in that way as well.
Yeah, I do. I over the years have seen really all kinds of different situations that occur. So, yeah.
Right.
But certainly a woman who's coming to me at 38, who's been trying to conceive for a year, if she has not been evaluated by a reproductive endocrinologist yet, I will send her for an evaluation because it's important to really know, that there isn't something else going on that maybe acupuncture can't help them.
Right.
And so I don't want them to invest a lot of time here when they knew that they had to go straight to IVF in the first place. If they knew.
So they can rule out other
Exactly.
things.
Yeah. So.
Yeah. Great.
Yeah.
Okay. Well, that's a good intro, and maybe we can make a few other videos again into more specific aspects of what you do for people.
Okay.
Okay.
Thanks, Ben.
Yep.